Okay.
So thanks everybody for joining us, and thank you, Harry, for joining us as well. I'm Morgan Whitman-Grauman. I'm the Executive Director of the North Carolina Alliance for Health, and we're so excited to have Harry Kaplan, the Senior Advisor for State Government Relations with McGuireWoods Consulting, with us this morning to just talk a little bit about what happened in the most recent legislative short session, which was supposed to kind of end yesterday and is still going on. So we'd love to hear your thoughts on that, Harry. And then also talk a little bit about what we're expecting to see when the General Assembly comes back in September and then thereafter. So I'll also let you know we are going to have a Q&A section. So if you would like to you have a question for Harry, go ahead and type that in the Q&A box and we'll do our best to get it answered. And if we can't answer it during this webinar, we will do our best to follow up with an answer afterwards. This is also being recorded. And so we'll make it available on our website in the next few days. So Harry, thank you again for joining us, and I will turn it over to you to just kind of talk about what they took up this past session, what they didn't, and then some of the priorities that you've been working on with us.
Hey, again, I apologize profusely for my technological deficiencies. I'm so sorry. I started a little early trying to get on and couldn't figure it out. Anyway, I guess all's well that ends well, but I apologize. So the short session is still ongoing, as you said. In fact, they're meeting this week. They're mainly doing veto overrides, although there are a couple of other cleanup issues they're working on, including a very strange issue that popped up in the last few weeks regarding a bill that the Department of Health and Human Services requested that dealt with, among other things, access to records, law enforcement records, that became controversial, which had been out there for months, so that anybody saying anything about it, and passed unanimously. And then people discovered some language that concerned them, and so they've spent the last couple of days trying to fix that. The governor vetoed the bill, and even though it came from his agency, it was written by his agency, but hopefully they'll get that straightened out. But that's been one of the side issues they've been working on. As far as the issues that we were working on together, there were a couple of significant ones, and one of the most significant things we did get done was House Bill 1023, which includes funding for the school nutrition programs. There's money to eliminate the school lunch copay, which is very important, and money to deliver transportation. Money for transportation to deliver meals, and then $75 million that extends from May to the end of the year for the school nutrition programs. That doesn't increase the amount of money, but extends the time period that money can be used. The copay money is good for the entire school year, and as is the transportation money. So that was a significant victory. The other major thing that I was working on besides that was the Medicaid funding / transformation bill, which was Senate Bill 808, which is an historic bill for North Carolina. So about 25 years ago, there began an effort to introduce managed care into the Medicaid program. And then about 7 years ago, that effort became more intense with legislation being introduced and passed at the General Assembly. There were several bills that were passed, but still we weren't there as far as implementing the Medicaid transformation until just the other day, when we finally passed a bill that actually allocates the money and also fixes some other issues that needed to be fixed in order for the Department of Health and Human Services to actually implement the program. And so now, allegedly, next year, starting on July 1st, 2021, Medicaid beneficiaries will begin enrolling in one of the 5 prepaid health plans that have won contracts to provide Medicaid services in North Carolina. And that process can take up to 5 months to enroll all the enrollees, all the ones that were eligible. There are categories of Medicaid enrollees who will not be part of this, but for the most part, most Medicaid beneficiaries will be. And the ones that are in categories that aren't will be probably gradually phased in over time. But it's a significant step in North Carolina because 38 other states have done this. We have not. This is something that began as very controversial and was not embraced by the provider community or the hospitals, doctors, or anybody on that side of the ledger. But over time, especially lately, more and more folks have come to realize, and it's not been a partisan issue, that this is a good idea because, for among other reasons, these private Medicaid companies can provide services to people that can't be provided in the state-run Medicaid program. For instance, services like refrigeration for medications, electricity for your house, a ramp for the front yard, transportation to the doctor, all those things that are not traditionally covered under Medicaid can and will be covered. And we will be implementing something very near and dear to the Secretary of HHS's heart, Dr. Cohen's heart, and that is care for the full individual, the full person. So provide behavioral and physical health coverage. And we've always separated those, which doesn't make much sense because they are inextricably intertwined for the overall health of the individual. And now we can do that. We'll be able to do that much better. She's also implemented a social determinants of health program in line with the transformation, which again will help Medicaid beneficiaries providing those services that are related to healthcare and are necessary to get good healthcare, but have not been provided in the past. So all that I think is going to be good, and it's going to be a challenge, logistical challenge, a technical challenge, and the race is on now. We have a year, which it seems like a long time, but it isn't these days. So we're up and running. That was Senate Bill 808, one of the last bills that passed. It passed almost unanimously. I think there were 2 votes against it on the House side. The governor signed it into law the other day. So that's moving. Another key bill that passed that I'll mention is Senate Bill 361, which was a healthcare omnibus bill that had several different parts to it. The one part I'll emphasize is step therapy, changes to step therapy protocols, which is something that was negotiated last year and then took a while to actually get done. Technically, the General Assembly, due to unrelated issues that kept it from getting enacted. But it's a very important legislation that was negotiated by stakeholders, providers, advocates for patient groups, and the health plans, and also pharmacy benefit managers to put into place protocols, better protocols, improved protocols for handling what's called step therapy, which means what you have to, the steps you go through to get different prescriptions, different medications that you might need for your treatment, to make that process more transparent, to offer a better, improved appeals process, a faster appeals process if you don't get the medication that you feel like you need at the beginning of your treatment process. And this was legislation. It's a milestone in North Carolina that will hopefully improve care, make the process, as I said, more transparent. And it's something that everybody signed off on and agreed to, and it will go into effect, I think, in January. So that was Senate Bill 361. Morgan, am I leaving anything out that I should mention?
I want to just touch base on all 3 of the things you said. Just, as far as step therapy goes, that's something that our partners at the American Cancer Society Cancer Action Network have been working on diligently for years. So kudos to them for, getting that through. Obviously, Medicaid transformation is huge, and we're so excited to see that funding. And I think we agree, I know we agree with Secretary Cohen in that we need to be, thinking about the whole person and also the social determinants. So we're excited to see that included. And then also just want to go back to the copay. This is historic. I mean, North Carolina has never funded school nutrition programs because they wanted to before, right? Like, they've only provided funding because they were mandated as a match by the federal government. So I just want to take a second to just acknowledge that how exciting it is to see North Carolina support school nutrition in this way, and that we really hope that this is kind of a stepping stone for additional support in the future, and that this funding was on top of that $75 million that you talked about to support them as they're, dealing with trying to make sure that children are fed during the current pandemic situation. So I think there was a lot of there were a lot of good things that happened this session, and it was really exciting. I also just want to mention what things we didn't see. One of them being the cuts to tobacco prevention and cessation, which we were kind of worried about, as we're seeing these revenue shortfalls, right? That we were worried that they were going to start pulling funding from some other programs, and that was one thing we were thinking about, but that didn't happen, so that's great. And then also something we worked on, Harry, was the ABOD issue. So this issue that adults who are able-bodied, adults without dependents, are required to work a certain number of hours a week in order to be eligible for SNAP. And right now, obviously, with a lack of jobs, it's very difficult to meet that requirement. And a couple of years ago, the General Assembly had passed the statute saying that DHHS couldn't apply for a waiver to those rules. And so we were working with our partners at DHHS and some others to try and create an exception to that statute that unfortunately was in a couple of different bills and just couldn't seem to make it across the finish line. So I don't know if you had any other thoughts on either of those things either.
We came close to getting that done, and the reason it didn't get done was not because, unfortunately, sometimes things don't get done at the General Assembly, and it doesn't happen because of the substantive issue. It happens because of other things, sometimes unrelated, political issues, other issues involving other bills, issues involving which people are doing what to whom. It's a legislative process. It's not a pretty process sometimes. We got, unfortunately, caught up in some unrelated things that prevented that from happening. It was very frustrating because we came really close. But as they raced toward the end of the session, a lot of things happened, some good and not so good. And people always lament the fact that we're always there till 3 o'clock in the morning on the night that they're finishing, or actually early morning they're finishing a session. And people ask why that has to be. And all I can tell you is I've been lobbying for more than 32 years now. In every session, it doesn't matter who's in charge, it always ends up that way. And the reason is because of human nature. I mean, you would think that people could spread things out and do things without having to go crazy at the end of a session, but people put things off until the end to try and get leverage over somebody else about something. They know somebody wants something, they want something. It just always happens, and it doesn't matter who's in charge or what the dynamics politically are. It's just human nature, and so that's what happened again. And we got caught up, unfortunately. And there were a couple of other things that happened and didn't happen because of the same reasons. And it's one of those things where we'll just have to come back and try again on some of the issues that we're facing. We're trying to, but as you said, the really good news on the nutrition front, we'd asked for $5 million, we got 3.9. And that's a pretty good percentage. And you don't usually get exactly what you ask for. The other thing is, but when you come close, that's good. The community health centers got more money than they asked for, which is, I mean, they got money in the COVID bills that passed in early May at the beginning of the short session, which was a COVID session the first few days, as you know. And then they added money in the same bill, 1023, that had the school nutrition. They added money for the community health centers as well as for several other programs that were very important. We also worked hard to get the food banks extra help, and they got extra help. So, I think overall, even though we had a couple of disappointments, it was a successful session. Also because of what you said too, in that there were several things that we were worried about happening to us that didn't happen. And so we had some folks protecting our flanks as we were trying to get some things accomplished, some new things. We were trying to protect some things that have been in existence for a while. And fortunately, we had some powerful legislators who protected our flanks while we were trying to get other stuff. So it was a team effort. A lot of folks were involved. And as you know, we were in constant communication. It's been difficult lobbying with the COVID situation. People started to come back to the legislative buildings in June. I know I went down there, but I didn't stay all day like I normally do. People were cautious. It was more difficult to get meetings with legislators. A lot of legislators were attending, especially in the House, were attending meetings remotely. So it was challenging to get the face time you needed to lobby. and we had to adjust on the fly. But we had a great group of people working on this, and on the issue of 361, I also want to applaud the Cancer Society, because they were one of the major stakeholders, but also the Muscular Dystrophy Association and several other groups. It was a really collaborative effort. It's fun when those things come together and we can all agree. And we worked with a great legislator, Representative Potts, who pulled us all together and then kept us going. And then we got across the finish line. It was one of the last bills that got adopted on the early morning hours of Friday, June 26th. It was about 2:45 in the morning when it finally happened. And the reason why it was delayed was because it was being used as leverage for some other things people wanted, which fell away at the last minute, and we ended up getting the step therapy after all. That's probably more in inner detail than people need to hear, but it was that I felt a lot of satisfaction in getting that done, especially since it was one of the last things to get done. So.
Absolutely. Yeah. And I want to just touch on something that you talked about too. As a coalition, we obviously always understand and appreciate the power of collective action, right? And working together to get things done. But I think more so this year, it felt like there was more collaboration. There was more communication almost, which is kind of funny because we weren't all down there together like we normally would be. But I have been really impressed with people just coming together to make sure that things happened. Or it didn't happen, which depending. But it was a very interesting session. And they're not done. So we were expecting them to leave yesterday based on the adjournment resolution, and they're still here today and taking up some vetoes. So can you talk a little bit about what you're expecting for kind of the rest of the week, and then in the future, because the adjournment resolution did indicate that they're going to come back in early September. So can you talk about that a little bit?
Sure. So the vetoes, of course, obviously have mostly to do with the reopen North Carolina stuff, reopening different things, bars, gyms, bowling alleys, ice skating rinks, playgrounds, you name it. That's what most of the vetoes had to do with, although, as I said earlier, one of the vetoes had to do with Senate Bill 168, which became this big controversial thing, which I think we've got resolved. But then a couple of other things have come up, just, here and there kind of things. So approving a legislator to the board, what's called the Board of Review. Representative Jean Farmer Butterfield is leaving the legislature to take a position on that board. She's been appointed, she'll be confirmed probably today. There are a number of other cleanup type bills, technical issues, but nothing really major. They've tried to keep it narrowly focused on a couple of things, but it has taken longer than they thought. And so my guess is they'll be here till tomorrow, and then they'll be gone. And they'll be gone, and they'll be able to raise money and campaign, which they need to do. Obviously, it's an election year. They will come back according to the adjournment resolution on September 2nd, and they're supposed to be taking up COVID-related appropriations matters on the 2nd and 3rd September. So what that means is they're waiting for more guidance from the federal government on how to spend, I think around $600 million is still left of the federal money that came down in the CARES Act, that they would like to be able to use in more innovative ways than the current federal guidance appears to allow. So they've asked, and every state has done this, not just North Carolina, almost every state has asked for additional flexibility. We're waiting to see how much additional flexibility we will get, because this money has to be spent by the end of the year. So we're hoping that we can plug some budget holes with it, and hopefully get some additional raises to state employees and teachers, get some additional money for programs and matters that are not directly COVID, but they're related. We've run into issues because of COVID. We've run into problems and challenges, and including pretty big revenue shortfall because of the COVID situation and the shutdown that happened in the spring, and the continuing struggles we have to reopen So, you know, right now, the resolution says they come back the second they adjourn sine die, which means the 2-year session ends on September 3rd. So when they adjourn sine die, that means everything that's been considered during the 2-year session that didn't pass is now officially dead. And you'll start over again when the next long session starts, which would be at the end of January, or maybe the middle of January to organizational session, and then end of January for the real stuff to get going. That can change, you know, if they need more time. That can change. They can come back before then. But right now, the adjournment resolution calls for them to come back the second and adjourn sine die on the third. And then they would run pell-mell toward November's general election. We find out what happens with that. And then the new General Assembly gets organized in January, and then we start our next 2-year session. So not much of a break for the weary. You know, it seems like, I mean, I've been doing this for a long time, as I said. It used to be a break. It used to be a definitive break in the action. And there really isn't one anymore. It seems like a full-time, year-round situation, which, of course, for lobbyists, we really can't complain. That's our job. But for legislators who are not supposed to be full-time, you know, they are full-time. And they get paid $14,000, most of them, to do that full-time. So it's a challenge for them, for a lot of them, to keep up with their families and if they have other businesses, and if they have lives outside the legislature, if they're not retired. You know, it's very difficult and challenging. So it's hard to get good people to stay, to run in the first place. And then stay.
And to run. I mean, I think we've seen a lot of people who can't run because they can't afford $14,000 a year and have that much of a time commitment with that low of a salary, right?
Right.
So it's definitely an equity issue. In addition to.
Yeah, and it's not going away.
Yeah.
Now we do have an increasingly diverse General Assembly, and we do have a lot of good folks, including a pretty good number of younger folks who are running and winning. So there is that diversity, but I worry that over the long haul, it's hard to keep those folks, even if they run and win, because they realize what a strain it is on if they're raising families, if they're trying to, you know, make enough money to provide for their families. You know, it's very challenging, and you worry that at some point the legislature will be completely consistent entirely of older folks who retired or folks who don't need to work for a living. You know, and that's a problem right now. Not so much, but you know, it's a worry for the future. But you know, we're in for an interesting election season, to say the least, and you know, November will be here before we know it. Actually, it can't happen fast enough for some of us. So.
Yeah. So I also just want to go back to something you were talking about as far as the content of session, right? So this past couple of weeks has been kind of a more traditional short session in that the topics that they've taken up have been things that they would traditionally do during short session, right? So appropriations type things, bills that made crossover, appointments, study committee bills, things like that. But my understanding from the adjournment resolution is that in September, they're only going to be taking up COVID-19 CARES Act appropriations. Do you foresee that changing at all?
I don't. It could, but I don't. But that reminds me of something I should mention. You know, normally the short session, which is what we've been in, is to adjust the 2-year budget that the General Assembly and the governor have adopted. And as you all know, last year, the governor vetoed the budget bill, and the General Assembly tried to override it, or at least the House did override it in a very controversial way. The Senate did not. And so we didn't have a budget, even though several attempts were made to get a budget agreement. And that was what held up the Medicaid funding transformation compromise that ended up finally passing on the last day of the session on June 26th as well, because that was tied to the vetoed budget. There were provisions in the vetoed budget. So we didn't have a traditional second year of the 2-year session, short session, where you adjust a budget because there was no budget to adjust. What they did instead was they adopted some mini budgets, really even smaller than mini budgets, if that makes sense, but very targeted appropriations bills that didn't spend a lot of money. because we don't have a lot of money. We had a lot of money before the COVID situation happened, and then all of a sudden the bottom fell out, and now we're spending money from our reserves and from our workers' compensation funds for those that have been unemployed and all that. So all of a sudden there was no money. We thought we were going to have a surplus and be able to spend some money this summer on some things that we were trying to do, frankly. And all of a sudden there was no money for additional tobacco cessation programs, additional, health programs that we wanted to see happen. We couldn't get done and nobody could get done because there was no money. So these very targeted small appropriations measures. And then at the very end of the session, there was a bill that took uncontroversial technical budget issues out of House Bill 966, which was the vetoed budget bill from last year, and put them into a cleanup technical budget bill that passed on the last day of the session as well. And that was partly what was going on in 1023 as well, by the way. And then there was a couple other bills that did that. So it was confusing. It was a little chaotic. It was a lot of little things going on instead of the usual budget bill that we expect to see. So the last 2 years, have been very unusual. Of course, since March, it's been extremely unusual. But the last 2 years have been unusual as far as how we normally do business here. And that is a function of a lot of different things that we don't need to get into now. But, that made this entire 2-year session, especially this summer, very challenging and different.
So I think it's worth mentioning that in the budget that was vetoed last summer, there was funding for tobacco use prevention and for the reduced price lunch copay that you were able to work with us, and we were able to get that in. So there were things that we cared about in that budget as well. So we're glad to at least see the copay part move forward, and hopefully next year we'll be able to come in and work on the tobacco pieces as well and get continued funding for the copay, because that is only for 1 year right now until they determine how much money is needed to keep it going. But you also said something that, as a lawyer, I love statutes and rules. I just think they're so cool, and I really enjoy looking at the procedure that they use and how they use the procedural rules to kind of do whatever they want. And you kind of talked about it was a little chaotic, and was wondering if you could talk a little bit more about, there were a lot of PCSs, proposed committee substitutes, where they stripped bills that had been filed in like March of 2019 and put in completely new legislation. And we've seen that happen. That happens every session, but I feel like it happened more this year. Can you talk about that a little bit?
Yeah, people lament that process because it's not a good process for a lot of reasons. But it's happened throughout the time I've been a lobbyist, over 3 decades. But as you said, it's become increasingly common in the last decade or so, and both parties use it. And the simple reason is it's just faster and easier, quote unquote. So they'll take a bill that has passed, and they ran out of bills. Actually, you were saying about how many times it happened in the summer. It was happening so frequently this summer that they ran out of vehicles. Because what you need is a bill that's passed. If you're in the Senate and you want to do something, you take a House bill that passed the House and no longer is needed, and you strip it and make it a Senate committee substitute. The same thing over on the House side. And you had some legislators who, normally the legislator who is the sponsor of that bill that's being stripped is consulted, at least told that their bill is going to be warned that the bill is going to be stripped. Things were happening so rapidly in the last few weeks that there were several legislators who complained they weren't even informed. The bill had been taken and stripped
Right.
and used for something else.
Yeah, and that's problematic because their names, unless they remove their name, which they can do, but their name is still on a bill that might have absolutely nothing to do with what the original content of the bill was, right? So
that's disconcerting, to say the least.
Mm-hmm.
It's also not good legislative process because obviously when things are happening that fast, the law of unintended consequences plays a lot more. So you think you're doing something the right way, and you think you're doing something that's necessary, and you probably are, but you're doing it so fast that mistakes are made in the language that that's what happened with Senate Bill 168. I mean, no one thought that was the committee substitute on the House side was an issue. I mean, it passed unanimously, and it was the department that wrote the bill, Department of Health and Human Services. But there was language in there that turned out to be inartfully drawn, to say the least. And in the age of what's happening out on the streets, people concerned about racial justice,
the Black Lives
racism,
Matter movement.
All that. Is very. There's some topics that are very sensitive, including records, law enforcement records. It's a very sensitive topic, and the way I read the language, I didn't read it to mean what people thought it meant, that were concerned about it. However, because it happened so quickly, social media takes these things and boom, they're out there. And whether it's true or it's not true, the perception is reality. And so they had to quote unquote fix it. And they did. They are fixing it. And the governor was in an awkward position because his administration asked for the legislation. His administration wrote the legislation. The General Assembly passed it because of at their request unanimously. And then we find out that this issue is there. And he said that in his veto message. He said, "Hey, look, nobody intended for this to happen. We just have to fix it." So they did. But that's a good example, I think, of how things get done so quickly that mistakes are made unintentionally. And sometimes people find,
those bills don't go through the same committee process, right? Because as you're talking about, they usually pull a bill that's already passed one chamber, and then they make the changes, and then the chamber it's already passed just approves the changes or not. They concur.
Well, what happens is, so take 168 as an example. The House does a committee substitute, sends it back to the Senate. Now the Senate can vote not to concur. And then that gets thrown into a conference committee, and then there's a conference report which can't be amended. Once they agree to a conference report. So short circuits. Some issues are complex enough. A lot of issues are complex enough. They need to go. There's a reason why we have a committee process. There's a reason why we take time. Step therapy is an example of that. It took 6 months. Okay, it's a complicated issue. You want to make sure you're doing it right, and so. You get people together, you talk about it, you go through several different drafts, you go through several committees in both chambers. In this case, it also went to a conference committee. And throughout that entire process, usually things get improved, or at least they have a chance to get vetted thoroughly and people understand what's happening to them one way or the other. When you have a short-circuited process using proposed committee substitutes and conference reports, you don't have the chance to have that vetting happen. And so there's surprises, there are unintended consequences, there's poor writing. And you have to go back later and fix stuff that if you'd taken the time to begin with, you'd ended up probably saving time at the end of the day, and also getting better legislation. But again, it's part, whether we like it or we don't like it, and I don't think anybody really likes it, it's part of the process because of the way we legislate, because of human nature, and because, frankly, it's a more polarized atmosphere. We do have a good. I think one thing about the COVID-19 crisis, pandemic, is it has brought people together better. We saw a lot of cooperation, bipartisan cooperation, particularly when the short session began April 28th, and we just focused on COVID. There were the task forces the House set up, which were bipartisan, and the chairs were bipartisan. The legislation was bipartisan. The Senate didn't set up the same thing, but they also had a process that involved both parties. And at the end of the day, it was a pretty collegial, collaborative process that we'd like to see happen a lot more often. That broke down a little bit during the rest of the short session, but you still saw probably more cooperation than we saw last year. And so that meant we were able to get things done, like the Medicaid funding transformation bill, like the bill that includes the elimination of the copays. those things happened because we had cooperation and collaboration. One area where we didn't was on some of this controversy relating to what should be open and what shouldn't be open, and how fast our economy should open, and all that. That was probably more partisan, but there was more bipartisanship on some things than I've seen in a while, and maybe, hopefully, that can continue into next year. So that's part of the good news. But I really think that next year, whoever's in charge and whatever happens, you'll probably see some rule changes to scale back a little bit on the use of the strip and replace method of legislating. It's gotten out of hand. I mean, some of that's unavoidable. It is unavoidable, but when it becomes the predominant way to do business, you got a problem. And I really think whomever is in charge will probably make some rule changes to scale that back some, because it's not been going in a good direction.
Great. So thank you, Harry. We really appreciate that. I have a couple of questions if you're
Sure.
open to that. So the first says, so essentially the rollout for Medicaid transformation will take effect in 2021, and does it include the Healthy Opportunities pilots?
I'm trying to remember the Healthy Opportunities pilot.
I believe that it does.
I believe so. Yes.
Yes.
Yeah, that's my recollection. Yes, it rolls out July 1, 2021. That's when the first enrollees are supposed to be in the program. The secretary has the flexibility to phase it in. In other words, she can start off by having one or two regions of the state enroll first. And that's what she wanted to do before, when this was getting ready to happen, and it got derailed. I think that'll happen again. I think it's smart to roll it out in phases, and she has 5 months to do that. So between July 1st and November 30th of next year, you will see this happen. Now, the bill did initially include some penalties to try and make sure the department did in fact start on July 1st. Those penalties were removed because the governor wasn't going to sign the bill if they were still in there. And they were controversial. So there are no penalties. However, I think there's sufficient both pressure and incentive for the department to want to get this done. And, they have to restart some things, and it's going to take some time. And a year's not a lot of time, but, they already have the enrollment broker on board. They already have the plans picked. So hopefully it'll roll out relatively smoothly. You never know.
Great. I've understood the funding for food banks didn't pass. Any thoughts on why not? So there was $6 million in the initial COVID recovery package, and I don't think there was a request for additional funding in this short session that I'm aware of.
Well, there was, so I think what's being referred to there is that in the budget that got vetoed, there was additional funding for the food banks, an additional $3 million on top of the $3 million. We've had $3 million for the 6 Feeding the Carolinas food banks plus the Interfaith Food Shuttle for decades. Well, that amount of money has increased over time, but we've had $500,000 a piece, for a long time. There was additional money that was in the budget that got vetoed. However, we got more money in the COVID bill 1043 that passed and that was enacted in early May, $6 million additional for the food banks. So that did happen, and they are, I assume, are getting that money in addition to the money they get already.
Right.
So there was not an additional ask beyond the $6 million that was enacted back in May. There was not an additional ask. But as I said earlier, the community health centers and a few other folks got some additional money. It was the free and charitable clinics and the community health centers were among the others that got some additional funding. The food banks didn't request any additional funding beyond what they got back in in May. So,
right. I also think it's worth noting that there was some additional funding for TANF, the Temporary Assistance for Needy Families, in 168, which got vetoed, which they're now working to put in a different bill to pass in these next couple of days, is my understanding. So there are some other kind of food assistance related funding that happened both in the Recovery Act and is currently trying to be worked out now. So it's promising to see that commitment. Any discussion about COVID-related appropriations on smoking or tobacco use cessation, since those who smoke have a more difficult time recovering from COVID?
Yes, we use that argument. Unfortunately, it didn't. We weren't successful in that argument. With that argument, it makes a lot of sense. I don't think so, simply because the money that's left is not a lot. It seems like a lot, but it's not a lot for the needs that are out there. I don't think we're going to see additional funding for those programs this year. That we can ask and we will, but I'm not optimistic about that.
Yeah, I mean, I think, we talked earlier, we did make that ask. We were basically told, no, stop asking, right? And then kind of transition to, well, at least leave the money that's already there, right? Like, don't strip that funding, because this is critical. And we know that cessation is going to help people and help decrease the number of complications related to COVID if there are fewer people smoking. So but I think it's still on our radar. And I think as we hear more from the feds about how the CARES Act money can be used and the flexibility there for it, we'll definitely make that pitch again. And I think there are also more studies that are starting to come out. It's been a couple of months now. There's been more time for research, and that will continue through the summer. So definitely on our radar.
Definitely.
Oh, this is one of those process questions. Oh, where to go? Okay. What does the law say about when the legislature should be in session? I'm guessing I'm asking, is it turning into a constant session because the legislative direction is not clear?
That's a very good question. So North Carolina is one of only a few states, and I can't remember the number right now off the top of my head, that don't have a specific beginning and end to their session. So most states, like Virginia, for example, I think it's 60 and 90 days, depending on the year. South Carolina, it's 120 days, I think. Don't hold me to that. But most states have specifically defined legislative sessions, whether it's 60 days or 90 days or 120 days. Some states, it's every 2 years. Texas is that way. In some states, it's year-round. It's like Congress. That's Illinois, California, Massachusetts, New York, places like that. They take recesses and breaks like Congress does, but they're basically full-time year-round legislators, and they get paid like it. They get paid, some states they get paid six figures. So, it depends on the state. North Carolina is one of those few states that does not have defined beginning and end of session. It's up to the General Assembly that gets elected, and they elect their leadership, and then the leadership decides what the session is going to look like. So when they adjourn sine die in September, if they adjourn sine die in September according to plan, that final adjournment resolution will specify when they reconvene for the beginning of the next 2-year session. Normally, that's the last Wednesday in January. But in recent years, they've been convening in early to mid-January for organizational session, a couple of days to get organized, elect their leadership and stuff like that. Then they recess until that last Wednesday in January, and then they begin their regular order of business. That's been the trend in the last couple of sessions. And then there's no end to the session. It's up to now, they're supposed to have a budget done by the end of the fiscal year, which is June 30th. And in the past, if they didn't have that budget done by June 30th of the long session year, which next year it will be, and it was 2019 last time. In the past, if they didn't, then they would have to pass continuing resolutions to keep the government going. Otherwise, the government would shut down. Well, they solved that problem, as I solved in quotation marks, a couple of years ago by passing legislation that says, hey, if we don't have a budget we just continue with the old budget, the recurring money in the old budget. So we are still operating under the 2017/19 budget that was adopted in, I think, late June of 2017, and was amended in 2018 in the short session that year. We're still operating under that budget as far as recurring funding. So state government didn't shut down when the governor vetoed the budget bill last year because of that legislation, which says the state government continues to operate. The bad news is that anything that's non-recurring, and a lot of money is non-recurring, just stopped getting funded. So we had this pretty big budget surplus because a lot of money went unspent. And that's why we were looking forward to this summer before COVID hit, because there was a lot of extra money to spend that politicians love having before an election. And they were eagerly looking forward to trying again with a budget with the governor. And they were going to lavish all kinds of raises and all kinds of stuff. And then COVID hit and the surplus went poof. So normally the budget's supposed to be done by the end of June. But there's less pressure now because of the legislation I mentioned. But the General Assembly can and does often go past that date. And so some years it's gone till September, October, July, August. It's all over the map because we don't have a definite end to either our long or short sessions. Again, one of the few states that doesn't do that. There are positives and negatives to that because in states that have a defined session, it's a little bit misleading because when you only have 90 days to meet and pass legislation, you end up having very active interims with very active committees that still meet. And so it's not like you're not busy in the interim. You're preparing for the next session. And so sometimes it's a distinction without a difference, in my opinion. But in any case, long answer to your question, but that's a good question.
Well, and we've already talked about the equity issue with the salaries, but also it's difficult to be an advocate when you don't know what their schedule is going to be. And, every year they come out and they say, we're going to be gone by this date. And then it's 3 months later and they're still working.
Well, you can't plan vacations when you're a lobbyist. My wife got used to that. We've been married now for almost 33 years and she's gotten used to it over the years that you just have to, when our kids were little, it was challenging. But fortunately, I'm part of we're the largest lobbying shop in Raleigh, McGuireWoods Consulting. We have 9 lobbyists. And so I'll take a vacation. I'll try and guess, the best timing to do that. I usually go to the beach in August. But if they're still meeting or something happens, I'm still going to the beach with my family and somebody here will cover for me. I learned a long time ago that if I could easily never take a vacation because, and so we have to look after other parts of our lives in order to stay married and all that good stuff. And still have your kids talk to you.
It's also interesting because a lot of times over holidays, Memorial Day, 4th of July, they'll say they're taking a break. But what really happens is that some of the high-level decision makers stay in Raleigh and flesh things out, right? So you really have to kind of be careful and pay attention during those times because how many times has it been right after Memorial Day? It's like Monday morning at 12:01 and the budget comes out, right? That they've been working on that whole weekend. So it's interesting.
That's not uncommon. So it's challenging, but it's part of the deal.
Yeah, keeps us on our toes, right?
Yeah.
Do you anticipate the expected budget deficit to impact the Medicaid budget?
That's a good question. It depends on how big the deficit ends up being. Right now, the shortfall is estimated to be anywhere between $4 and $5 billion over the next 2 years, which is a lot. But if the economy continues to improve, that could change. We could get more help from the federal government. We could be allowed to use some of the leftover money to plug some of that hole. We could get more money to help plug some of those holes. I don't think so. And I think Well, for one thing, the Medicaid funding transformation bill provides a good amount of funding necessary for the transformation. I think one of the reasons we're doing this transformation is for budget certainty. The risk is going to be shifted from the state to these prepaid health plans who are agreeing to these capitated contracts. And so hopefully that helps in mitigating any chance for reduced Medicaid funding. I don't think so. I think there are other places, but I think education is much more of a risk, actually. Most of the money, healthcare is a huge chunk of the state budget, but half the budget goes to education.
So we have a lot more questions. We're not going to be able to get to them all. So I'll touch base with you offline, Harry, and we'll get some of these answered.
Sure.
But one more, because we haven't talked about our active living agenda very much, which is one of the priorities that we worked on. And we actually did some work around a bill that would have repealed a requirement that all new jails that are built have outdoor exercise space, which we feel is very important. And so we worked on making sure that amendment wasn't passed. But something else that we've been working on for the past few years is master's pay for teachers. And we're specifically, we're concerned about all teachers. We think everyone who has a master's degree should be fairly compensated for that extra work, but specifically talking about physical education teachers. And there was actually a provision in a bill that was passed this session that reinstates master's pay as a monthly bonus, so they're not calling it master's pay, but it's only for teachers that were grandfathered in after it was eliminated in 2013. So the question is, do you see there being an opportunity to reinstate master's pay to everyone who wasn't grandfathered in, and when, if you see that as a possibility?
I think that was definitely a possibility before COVID. I think with the budget deficits we face, any new spending like that is going to be challenging. I think they want to do that, and I think it depends on, to some extent, the composition of the General Assembly next year, maybe. But regardless of who's in charge, I think both parties want to see that happen. The majority of both parties want to see that happen. The challenge is, are we going to have the resources to do that? Because if we're having to plug billions of dollars, you don't do that with the Department of Public Safety budget or the Department of Revenue budget or the Department of Insurance budget. These are pinprick little budgets compared to education and HHS, which is the vast majority of the funding. And that's where, unfortunately, cuts have to come from. And so I don't know. I hope so, but it depends on the economy and how, and if the forecasts are wrong and we get less of a shortfall than we expect. And we don't know. We don't know. I mean, there's a lot more we don't know than we do know about how all this is going to impact us. Mm-hmm. I think the economic recovery in the last couple of months, the number of jobs added, the increase in retail sales, all that has been welcome news. But all that's at risk as the cases continue to surge across the country too. So we don't know. I mean, I'm hopeful that things aren't as bad as we think they're going to be, and that we'll have the opportunity to do that. I think that's at the top of the list to try and do. The question is going to be, will the resources be there to do it?
Yeah, it's definitely at the top of our list.
Yeah.
It's definitely something we've been.
I think it's the top of a lot of folks' list.
Yeah. In addition to, we talked about also in that same bill, I think it was 818, Senate Bill 818, there was the suggestion that non-certified employees also receive additional pay. So that would be the school nutrition program staff members, the bus drivers who are helping to deliver meals right now, right? But that was a suggestion. There was no funding provided, which obviously, that was something that we had been asking for as well, because especially now, they deserve hazard pay. They've been working in and out, day in and day out, to make sure that our students feel or remain fed and are fed. So I think, making sure that our teachers and our education professionals are paid and well paid for the jobs, the incredible jobs that they're doing, is definitely on our list. So. Well, thank you, Harry. I really appreciate your time and all of your help for, well, the past however many years, but also this session. It was an interesting one, and we'll look forward to having you back maybe in September when they sine die, or after the election, because I would always love your take on what happens in the election. So thank you so much, Harry. We appreciate it. And thanks to everybody for joining, and we'll follow up with the recording as well as some additional answers to the questions we weren't able to get to. So.
Yeah, thank you very much for the opportunity to work with you all. It's very important to me, and I appreciate very much working with you, Morgan.
Thank you.
You're a wonderful person to work with, and the whole group really is. It's great causes we're trying to advance. I'm blessed to be able to be part of it, and look forward to continuing to work with you, and we'll talk some more.
Sounds good. Thanks, Harry. Bye, everybody.
Thank you all very much.